Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Imagine waking up in the morning feeling heavy, bloated, and uncomfortable. You sit on the toilet, waiting, hoping, but nothing happens. Hours pass. Your stomach feels tight, your energy drops, and that frustrating pressure in your lower abdomen just won't go away. Constipation is one of the most common digestive problems in the world, yet millions of people suffer silently every day. Right now, inside your abdomen, there is a pathway, a very specific highway your body uses to move waste out of your system. Most people have no idea it exists. They sit on the toilet, pushing, straining, feeling frustrated, wondering why their body refuses to cooperate. But the truth is shocking. In many cases, the stool isn't stuck because your body can't move it. It's stuck because the colon needs the right stimulation along the right path. Your colon is not just a random bag holding waste. It is a muscular tube nearly 5 feet long, carefully arranged inside your abdomen in a very predictable direction. And if you understand that direction, if you follow that path with your hands, you can help guide your digestive system back into motion. Think of your colon like a slow-moving conveyor belt. Its job is to move digested waste through the body using rhythmic muscular waves called peristalsis. These contractions push stool forward inch by inch, hour by hour, until it reaches the rectum for elimination. But when these waves slow down because of dehydration, poor diet, inactivity, stress, or aging, waste begins to sit longer than it should. And here's where the real problem begins. The longer stool stays inside the colon, the more water the colon absorbs from it. What started as soft, movable waste slowly becomes dry, hard, and compacted. What should move easily now becomes stuck like clay inside a narrow pipe. Studies have shown that chronic constipation affects nearly 16% of adults worldwide, and that number rises dramatically after the age of 60. But what's even more alarming is that many people try to force a bowel movement without understanding how the colon actually moves. Pushing harder doesn't fix slow movement. In fact, excessive straining can increase pressure in the abdomen, raise blood pressure, and even contribute to hemorrhoids or pelvic floor damage. But there is another approach, one that works with your body instead of against it. Your colon begins in the lower right side of your abdomen in an area called the cecum. This is where waste from the small intestine first enters the large intestine. From here, the colon travels upward along the right side of your abdomen. This section is called the ascending colon. Imagine this like the first vertical stretch of a road. Waste must travel upward here before it can move across your body. This is why abdominal massage always begins in the lower right abdomen. When you apply gentle circular pressure in this area, you are stimulating the very starting point of the colon's journey. Research into therapeutic abdominal massage has shown that gentle pressure can stimulate the mechanoreceptors in the intestinal wall. These receptors send signals through the enteric nervous system, the powerful network of nerves often called the second brain of your gut. When these nerves are activated, they encourage muscular contractions that help move stool forward. Now, as the colon reaches the top of the abdomen near the rib cage, it takes a sharp turn and moves horizontally across the body. This section is called the transverse colon. This part of the colon sits just beneath your stomach and liver, stretching from the right side to the left like a bridge across the abdomen. Massaging across this upper area is incredibly important because gas often accumulates here. Trapped gas can slow stool movement and create the uncomfortable bloating so many people experience. As you gently massage from right to left under the rib cage, something remarkable may happen. You may hear gurgling sounds. You may feel subtle movement beneath your fingers. Those sounds are not random. They are the digestive system waking up. They are the muscles of the colon responding to stimulation and beginning to contract again. But the journey isn't finished yet. Once the waist crosses the abdomen, the colon turns downward along the left side of your body. This is called the descending colon. Here, gravity begins to assist the process, helping move stool toward the final storage area before elimination. This lower left section of the abdomen is where stool often collects when constipation occurs. When waste sits here too long, it becomes compacted and difficult to pass. By gently massaging downward along the left side of the abdomen, you help guide stool toward the sigmoid colon and rectum, the final stage before a bowel movement occurs. And here is something many people don't realize. The direction of massage matters enormously. If you move your hands randomly across the abdomen, you may actually push against the natural flow of the colon. But when you follow the true anatomical path, starting in the lower right, moving upward, crossing the upper abdomen, and then moving down the left side, you are working in harmony with the body's design. Clinical studies examining abdominal massage therapy in patients with chronic constipation have shown remarkable results. Participants experienced improved bowel frequency, reduced bloating, decreased discomfort, and improved quality of life after regular massage sessions. And perhaps the most fascinating part is that this technique requires nothing more than your hands, a few minutes of time, and an understanding of the colon's natural pathway. No medications, no harsh laxatives, no chemicals forcing the body into action. Just gentle stimulation, encouraging the digestive system to do what it was designed to do. But timing also plays a powerful role. Your colon is naturally most active in the morning and shortly after meals due to something called the gastrocolic reflex. When food enters your stomach, it sends signals through the nervous system telling the colon to start moving. This is why many people feel the urge to use the bathroom after breakfast. Performing abdominal massage during this window can amplify the body's natural rhythm, making bowel movements easier and more predictable. And when you combine this technique with proper hydration, fiber-rich foods, and daily movement, you create the perfect environment for healthy digestion, because constipation is rarely caused by just one factor. It is often the result of multiple small habits slowly slowing the digestive system down. But when you understand the path of the colon, when you respect the direction your body was built to move waste, you begin to unlock a powerful, natural tool for digestive health. A tool that has been used in therapeutic medicine, physical therapy, and digestive rehabilitation for decades. A tool that reminds us of something simple yet profound. Sometimes the body doesn't need to be forced. It simply needs to be guided. And when your hands follow the natural road inside your abdomen, you may discover that the relief you've been searching for has been right beneath your fingertips all along. Deep inside your abdomen, something extraordinary is happening every second of your life. A silent conversation between your brain, your nerves, and the long muscular tube we call the colon. Most people never think about it. They only notice when something goes wrong, when the bloating begins, when the pressure builds, when the body refuses to release what it's been holding on to for days. Constipation isn't just uncomfortable. It's one of the most common digestive disorders in the world. Research published in the American Journal of Gastroenterology shows that millions of adults struggle with slow bowel movement every single day. And for many of them, the problem isn't simply diet, it's that the colon itself has stopped responding the way it should. But here's the astonishing truth most people have never been told. Your colon is packed with thousands of microscopic sensors called mechanoreceptors. These tiny receptors are embedded directly in the intestinal wall, constantly monitoring pressure, stretch, and movement inside your digestive tract. And when these receptors are stimulated the right way, they send powerful signals through the enteric nervous system, the vast network of nerves that scientists often call the second brain of your gut. This second brain contains more than 100 million nerve cells. That's more neurons than are found in the spinal cord. Think about that for a moment. Your digestive system is not just a passive tube moving food along. It is an intelligent, responsive system that reacts to touch, pressure, and movement. And this is where abdominal massage becomes incredibly powerful. When gentle pressure is applied to the abdomen, especially along the natural path of the colon, those mechanoreceptors begin to activate. They send signals through the enteric nervous system that stimulate muscular contractions inside the colon. These contractions are called peristaltic waves. Peristalsis is the engine of digestion. It is the slow, rhythmic squeezing motion that pushes waste through the digestive tract inch by inch, hour by hour, until it reaches the rectum. But when peristalsis slows down, stool begins to stagnate, and stagnation triggers a dangerous chain reaction. The colon's primary job is to absorb water. When stool sits too long, the colon keeps pulling moisture out of it. What started soft becomes dry. What was once easy to pass becomes hard and compacted. In severe cases, stool can become so impacted that medical intervention is required. Doctors call this fecal impaction, and it can lead to severe abdominal pain, nausea, vomiting, and even intestinal blockage. Yet what many people don't realize is that the colon often just needs stimulation to wake back up. Clinical studies examining abdominal massage therapy in patients suffering from chronic constipation have revealed something remarkable. Participants who practiced daily abdominal massage experienced increased bowel movement frequency, reduced bloating, decreased abdominal pain, and improved overall digestive comfort. In some studies, patients even reduced their dependence on laxatives. And the mechanism behind this improvement is rooted in simple physiology. When you press gently into the abdomen and move your hands along the colon's pathway, you are creating mechanical stimulation. This stimulation activates those pressure-sensitive mechanoreceptors. The receptors then send electrical signals through the enteric nervous system. Those signals trigger muscular contractions in the intestinal wall. And those contractions begin moving stool forward again. But abdominal massage doesn't only stimulate the colon mechanically, it also affects the autonomic nervous system, the system responsible for regulating digestion. When you are stressed, anxious, or constantly rushing, your body activates the sympathetic nervous system, often called the fight or flight response. This state diverts energy away from digestion and towards survival. In fight or flight mode, digestion slows dramatically. The colon becomes sluggish. Peristalsis weakens. Waste lingers longer than it should. This is why stress is one of the most overlooked causes of constipation. But gentle abdominal massage helps activate the opposite response, the parasympathetic nervous system, also known as rest and digest. This state tells the body it is safe to relax, safe to digest, safe to eliminate. And when that shift happens, something remarkable occurs inside the digestive tract. Blood flow to the intestines improves. Muscular contractions strengthen. The colon begins moving again. This is why many people notice something fascinating during abdominal massage. At first, there may be silence inside the abdomen, but after a minute or two of gentle pressure and rhythmic motion, the sounds begin. Soft gurgling, subtle bubbling, movement. These sounds are called borborygmi, the noises created when gas and fluid move through the intestines. Far from being embarrassing, these sounds are a sign of life returning to the digestive system. They are the colon waking up. They are the muscles of the intestine beginning to contract again. And sometimes within minutes, the body responds with the unmistakable signal that relief is coming. But the benefits don't stop with bowel movement alone. Abdominal massage can also help release trapped gas, which is one of the main causes of painful bloating. Gas pockets often accumulate in the transverse colon beneath the rib cage. Gentle pressure helps shift these pockets forward so they can move through the digestive tract naturally. Massage also relaxes the abdominal muscles themselves. When people are constipated, they often unconsciously tighten their abdominal wall, creating even more resistance against bowel movement. Relaxation changes that dynamic completely. The abdomen softens, pressure normalizes, the colon is free to contract without restriction, and over time, consistent abdominal massage may even retrain the colon to move more regularly. Think of it as physical therapy for the digestive system. Just as stretching and movement restore function to stiff muscles, gentle stimulation helps restore rhythm to the colon. But perhaps the most powerful part of this technique is its simplicity. It requires no medication, no prescription, no expensive treatment, just awareness of the body, understanding of the colon's pathway, and the gentle power of your own hands. Because the human body is not fragile machinery waiting to fail, it is a living, adaptive system designed to heal, respond, and restore balance when given the right signals. And sometimes those signals come not from a pill bottle, but from something far more natural. A few minutes of mindful touch, a few moments of patience, a simple reminder to the digestive system that it hasn't been forgotten. And when those signals reach the hidden nervous system of the gut, when the mechanoreceptors fire, when the colon begins to contract again, the body does what it has always known how to do: release what no longer belongs inside, restore comfort, and return to the quiet rhythm of healthy digestion. Constipation doesn't begin in the bathroom. It begins in the quiet habits of everyday life. Long before someone sits on the toilet feeling frustrated, bloated, and uncomfortable, a chain of invisible events has already been unfolding inside the body. The colon has been slowing down. Water has been quietly draining from the stool. Muscles that once moved waste effortlessly have become sluggish and unresponsive. And the shocking truth is that for millions of people, the problem isn't just what happens during a bowel movement. It's what happens during the other 23 hours of the day. You can massage the colon, stimulate the nerves, and encourage movement. But if the daily habits that control digestion remain unchanged, the relief will only be temporary. Because the colon is not a machine that can be forced to work. It is a living organ that responds to hydration, nutrition, movement, and even emotional stress. And perhaps the most powerful factor of all is something most people underestimate every single day: water. Your colon's primary job is to absorb water from the waste passing through it. Under normal conditions, this process helps form stool that is soft, solid, and easy to pass. But when the body is dehydrated, the colon goes into conservation mode. It begins extracting more and more water from the stool in an attempt to protect the body's fluid balance. The result is shocking. What begins as soft waste gradually turns into something dry, dense, and difficult to move. Medical research has shown that even mild dehydration can significantly slow stool transit time through the colon. In simple terms, the less water you drink, the harder your body works to hold on to every drop. And that means the colon pulls moisture out of stool until it becomes painfully hard. This is why doctors often recommend increasing water intake as one of the first steps in treating constipation. Hydration doesn't just support the kidneys or the skin. It directly affects how easily waste moves through the digestive tract. But water alone isn't enough. The colon also relies on something called dietary fiber, and this is where modern diets have quietly failed millions of people. Fiber is the indigestible part of plant foods that travels through the digestive system largely intact. But while the body cannot digest fiber, the colon absolutely depends on it. Think of fiber as the structure of a healthy bowel movement. Soluble fiber absorbs water and forms a gel-like substance that softens stool. Insoluble fiber adds bulk and helps stimulate the intestinal walls, triggering the muscular contractions that move waste forward. Without enough fiber, stool becomes small, dry, and difficult for the colon to push along. Research published in gastroenterology journals has shown that populations consuming high fiber diets experience dramatically lower rates of chronic constipation compared to those eating highly processed foods. Yet in many modern diets, fiber intake has dropped to dangerously low levels. Highly refined foods, white bread, processed snacks, sugary cereals have had their natural fiber stripped away. What remains is food that passes through the digestive system without providing the bulk needed for healthy elimination. The colon slows down, waste lingers longer, and constipation quietly becomes a regular part of life. But even fiber and water cannot fully activate the digestive system without another critical ingredient: movement. The human digestive system was designed for a body that moves. Every time you walk, bend, stretch, or twist your torso, subtle shifts occur inside the abdomen. These movements gently stimulate the intestines and encourage peristalsis, the wave-like contractions that push stool forward through the colon. This is why physical activity is so strongly associated with healthy digestion. Even a simple 20-minute walk has been shown to stimulate intestinal motility. Movement increases blood flow to the digestive organs, enhances nerve signaling, and helps the colon maintain its natural rhythm. But when the body remains still for long periods, sitting at desks, lying on couches, spending hours in front of screens, the digestive system begins to slow. The colon becomes quiet. The muscles become lazy, and waste begins to accumulate. But perhaps the most surprising factor affecting digestion is something we cannot see: stress. When the brain perceives danger, pressure, or anxiety, it activates the sympathetic nervous system, the fight or flight response. This system prepares the body for survival by diverting blood and energy toward the muscles, heart, and lungs. Digestion, in that moment, becomes a low priority. The stomach slows its emptying. The intestines reduce their contractions. The colon becomes sluggish. In modern life, many people live in a constant state of low-level stress. Deadlines, financial worries, lack of sleep, endless digital stimulation. The body interprets this stress as a signal that it is not safe to relax. And when the body cannot relax, it cannot digest efficiently. But when stress is reduced, the opposite system activates: the parasympathetic nervous system, known as the rest and digest state. This system restores blood flow to the digestive organs, strengthens intestinal contractions, and supports natural elimination. Deep breathing, relaxation, adequate sleep, and mindful eating all contribute to this state. And when combined with abdominal massage, hydration, fiber intake, and daily movement, something extraordinary happens. The colon begins to rediscover its rhythm. Bowel movements become more predictable. Bloating begins to fade. Pressure in the abdomen disappears. Energy levels improve, because healthy digestion doesn't just affect the stomach, it affects the entire body. When waste sits too long in the colon, toxins and bacterial byproducts can accumulate, contributing to fatigue, discomfort, and inflammation. But when elimination occurs regularly, the body maintains a healthier internal balance. The digestive system works quietly, efficiently, exactly as nature designed it. And perhaps the most powerful realization is this: constipation is rarely the body failing. More often, it is the body responding to the signals it receives every day, from what we drink, what we eat, how we move, and how we handle stress. Change those signals, and the body begins to change its response. The colon wakes up, the digestive system regains its natural flow, and something as simple as a daily bowel movement, something so many people struggle with in silence, becomes effortless again. Not because of a miracle drug, not because of a quick fix, but because the body was finally given what it needed all along: water, fiber, movement, calm, and the gentle guidance that reminds the digestive system how to do what it was designed to do since the very beginning of life.